Hello Ipswich, my name is Tony Marino and I am your town manager, and we're up to, I think we're in week 4 now of these COVID-19 updates. So I want to thank everybody for their social distancing and their patience, and thank them for staying home and doing everything they need to do to get through this crisis. I want to give it a quick update before I move it over to our first guest. We have an update on the firefighters. We have 9 on quarantine right now. All have tested negative, which is good news. They'll be back to work as long as they have no symptoms and everything stays the same. They'll be back to work on April 22nd. I want to thank them and their families for their patience during this difficult time. Certainly hasn't been easy, especially last weekend with the Easter holiday and whatnot, but they rallied and they were able to get through it, and I know get some meals over to them and things like that, but I want to thank them for their patience and understanding. And actually last night we had a couple of incidents in town, so I want to thank the other firefighters that have been filling in and making sure that we have the coverage we needed. We had a couple of small house fires last night, but the firefighters did what they always do, and they stepped up and did a great job, and I want to thank them for that as well. So on the police side, we do have 2 in quarantine right now due to exposure outside of work. And again, they were both tested negative, and we anticipate they'll be back on April 22nd as well. Those timelines just happen to line up. I want to give an update on the wharf project. A press release was sent out yesterday by the chief of police, and the state is starting the wharf reconstruction project. I do have some dates here. Today and tomorrow, the workers will be down there staging equipment, installing environmental barriers, and saw cutting some asphalt. From April 20th until May 11th, they will be demolishing and reconstructing the boat ramp. So the boat ramp will be out of commission between now and May 11th. But the good news is it will be back and rebuilt in plenty of time for Memorial Day, and to allow people to get their boats out to the moorings, et cetera, et cetera. So that's good. And we actually, special thanks to Chief Nickus for moving forward on this, because we pushed the state, and we also adjusted the schedule so we could make sure we got the ramp done first, so we'd have availability for that as early as we could. They anticipate they'll work until May 13th until June 9th. The workers will repair the concrete wall cap for the seawall and install the steel pipe piles for the floating docks. And from June 9th through 15th, the workers will backfill, repave, add striping to the pedestrian walkway, and wrap up the project. So by middle of June, this will all be over and we'll be back to normal down at the wharf. So the good news is with the restrictions in place, the quarantine restrictions and the stay-at-home orders, that the workers should feel like they'll be able to stay on track, and weather permitting, they'll stick to this timeline as much as they can. So that's the update on that. I just wanted to, as everybody knows, we've been delivering meals, and Sheila will give us an update on that, but I want to thank a lot of the local businesses that have donated stuff. We're getting a coffee delivery from Zoomies next week, so smaller packs of coffee that we can send out to the seniors. Those will come in next week. Vinwood Caterers has been great. They allowed us to have some food storage units, Cambros, and then a larger mechanical unit that plugs in that keeps the food hot for us. Just across the board, everybody's been generous, and we've received cash donations. And I will say, anybody that does want to donate to the effort, we do have some expenses incurred with the meals. So if you could, if you have the ability to, donate to the Friends of the Council on Aging. Those funds have been able to use to cover some of the expenses that have been generated from getting the meals out, and et cetera, et cetera. So that's all I have on the town side. With that, I'm going to pass it over to our first guest, Dr. Brian Blake, to give us an update on the schools.
Okay, thank you, Tony. Just a few updates and some reminders. The school committee voted to essentially rescind April vacation for next week, and instead have teachers and students work Tuesday through Friday in the remote learning environment. Monday is still considered a holiday. In canceling April vacation, the last day of school will be moved back to June 17th, 4 days earlier than previously scheduled. This change in the school calendar seemed to make the most sense given our current situation. Last week, the governor and commissioner determined that the MCAS testing for this year is canceled, so we don't have any worries with that. We're still working on and waiting guidance on the competency determination for seniors who still need to meet that criteria as part of their graduation requirements. I'd like to remind everyone that we started the remote learning website last week. That is up and running. All students should be actively engaged with their teachers at this point. If students aren't engaging with their curriculum work. They will be receiving phone calls from our administrators. Our track continues to be open Monday through Friday from 8 in the morning till 10 in the morning for folks to get out and walk. We have some volunteers there who are enforcing the social distancing protocols that are in place. I want to acknowledge our food service department and the staff that are helping to prepare and deliver meals Monday through Friday to our students. Remember that these meals are for any student who needs a meal, breakfast and lunch, not just those who are eligible for free and reduced lunch. The meal delivery locations and times are at Rosewood from 11:30 to 12:30, the Winthrop School also from 11:30 to 12:30, Agawam Village from 11:30 to 12:15, and Powder House Village from 12:15 to 12:30. I anticipate hearing either the end of this week or the beginning of next week as to the date our schools will reopen. As you know, we're scheduled to reopen on May 4th, but I anticipate that the governor is going to be extending that date to a date later in May. We're just not sure when. As soon as I have additional information, I'll share it with you. And then one last piece that I wanted to share. Each April for the last 28 years, the entire middle school community has walked to Great Neck and back in a community effort to raise funds for the local food pantry. Our annual goal is to raise $10,000. Last year, thanks to your efforts and a new online option, our amazing students raised $18,000. As you can imagine, the need is even greater now because of the social distancing guidelines, and Tony just spoke earlier about additional meals being served by different organizations in town. This year, we obviously can't do the Walk for Hunger, and there's a significant need. So I would encourage folks to make up your own virtual Walk for Hunger, or it can be a jump rope for hunger, a walk for hunger, crocheting or knitting for hunger, whatever you want to do in order to raise funds for the local food pantry. And we would ask that you donate directly to the food pantry, or you can email Kathy McMahon, the middle school principal, and she can share information with you on how to make those donations through the school. And that's about it for right now.
All right, thank you, Brian. Up next is going to be Colleen Furman, our Public Health Director. Currently, she'll give us an update on what's going on the public health side. I just do want to do a quick update. Currently, Ipswich has 26 cases of COVID-19 in town. We do have 13 cases still under isolation currently out of those 26. The rest have met the guidelines and are no longer under isolation. And again, as I said last week, of those 26, at least 5 are in the same residence. So one person got it, and then unfortunately a family member or somebody in the house got it. So those that included in that count of 26. So now I'll pass it off to Colleen, and she'll give us an update on the public health. Thank you.
Thank you, Tony. So I understand Tony has explained the case count in Ipswich. I also wanted to offer that starting yesterday, the Mass Department of Public Health will be publishing case counts for each community in Massachusetts. It will be at mass.gov, and I believe we will soon be linking the town website to that information. We are currently in the surge of cases in Massachusetts, so it's really important to continue following the guidelines. Stay at home except for essential trips. When you do go out, wear a fabric face mask. You also want to make sure you are social distancing when you're out, so that's avoiding crowds of 10 or more. It's ideally to be with as few people as possible. And you also want to make sure that you're standing 6 feet apart when you are communicating with other people. For those who are sick, you want to make sure you are following isolation guidelines, and it's really important to strictly follow that to limit the spread to other family members or household members. And those who may have come in contact with someone who is positive, or they know that someone is positive, they want to make sure they're following quarantine guidelines, and that's for 14 days from last exposure. If you have any questions on these guidelines, you can certainly call the Public Health Department, and there's also information available at the Ipswich website. I did want to inform people also, if you have some symptoms and you're not sure if it's COVID-19 or not, mass.gov does have a tool you can go to and plug in your symptoms, and they can also help you find care. Certainly, if you have a provider, you can reach out to your provider directly, but if this is, say, late at night and you're not sure and you're concerned, you can certainly go on mass.gov and use that tool. As far as what the Public Health Department has been doing since the beginning of this pandemic, I just wanted to update the community. So we do have, I'm on weekly conference calls with Department of Public Health, and that's through Maven. So that's the system we use to track infectious disease. So we have weekly conference calls on that to update guidance and to make sure we're consistently using the system properly. We also have weekly conference calls with the command center. The governor set up a command center, so they have an organized strategic approach throughout Massachusetts and all its departments on how we're handling COVID-19. So we do that weekly. And lastly, there's a basic Department of Public Health conference call with our local boards of health, and that's to update us on any guidance that's going to be issued. In addition to the state conference calls, we also have local health departments that are weekly getting together through Zoom meetings and sharing information and discussing what's happened locally, so we have a handle on what's going on in the communities surrounding us. As far as new information, I just wanted to share that yesterday the Attorney General's office rolled out a new website, frontlinema.org. And that is basically a one-stop shopping location for healthcare workers and frontline workers, so police and fire, to find out all the information regarding places to stay, emergency child care, discounted food locations. So that's a really important website, and it actually makes it easier to find that information. And as far as moving forward, there is a big initiative for the Department of Public Health to promote testing at long-term care facilities and assisted living facilities. The goal of this is to find out which residents may be sick, although they haven't started showing symptoms, and isolate them to prevent spread throughout these locations. So if you hear of an initiative where the National Guard may come in and do testing, don't be concerned. This is actually a good thing. And essentially, that is just to help out that facility to get through testing quickly so they understand what they're dealing with. If you need anything, the Public Health Department is operating 5 days a week in the normal work schedule, but also we check emails throughout the weekend, so if there's any emergency, we can respond. If you do not have someone answer the phone when you call, please leave a message. We're returning calls daily. Thank you.
Thank you, Colleen. And one thing Colleen didn't mention there is on top of everything else that's going on with the pandemic, they're also still answering questions for our local restaurant holders that have questions about COVID-19 and how they can operate under these conditions, as well as still doing some septic inspections and things like that, because as we know, construction is still going on, maintaining a safe social distancing, but that work is also going on. So kudos to your department, and thank you for a job well done.
Thank you.
All right, up next is going to be Lieutenant John Hubbard to give us an update on MEMA and what's going on with the state. Thank you, and here is John.
Thanks, Tony. Just want to give everybody a brief update of what we've been doing here in emergency management. It's pretty much the same we've been doing all along. We get daily updates from MEMA through email with daily briefings of everything that's going on statewide. And this afternoon, every Thursday at 1 o'clock, we have a conference call, a statewide conference call with all the other emergency management directors for the state. So I'll be participating in that again this week. The state's been doing a very good job trying to provide PPEs for first responders. We just were notified today that MEMA will be providing 5 N95 masks for every sworn officer in our department, so we'll start picking those up tomorrow, and that's on top of the delivery that the National Guard made to us last week. So our first responders are being very well taken care of by the state, and we're pursuing even more supplies that we can purchase. It's very difficult at this time to actually purchase the stuff, but we're trying to build a small stockpile, so we'll make sure our first responders are protected and they stay healthy. As you may know, that some of the first responders have had to go and be tested, and they're all coming back negative, and they're starting to come back to work as we speak. So we're in good shape right now, and once again, if you need anything from us, feel free to call, and we're still here to serve you 24 hours a day, 7 days a week, business as usual for us. So some things have to go over the telephone. We're not coming to people's houses as much, but we can handle a lot of stuff over the phone, so feel free to call us, and we'll help you out as best we can. Thank you.
All right, great. Thank you, John. And special thanks to you and all of our public safety personnel, both police and fire, like I said before, for doing a great job. So thanks again. Up next is going to be Sheila Taylor from our Council on Aging Director to give us an update on what's going on with our seniors and all the services that we're currently providing.
Thank you, Tony. Today I have something very important that I want to say about the stimulus relief check that you are waiting for, if you have not already received that. If you receive Social Security that is directly deposited into your bank account, you do not need to do anything. Your stimulus funds will be deposited directly into your account. For others, there is a website for people who are not required to file taxes or do not receive Social Security, where you can enter payment information to receive your stimulus relief check directly to your bank account. If you are one of these people, we would prefer that you speak to me or Beth before registering on the website. It just might be an extra and complicated step that you don't need to take. Although it is a valid website through the irs.gov site, we are just so worried about scammers that are waiting to take advantage of this option. So please just be careful about that. Last week, I mentioned that our van is not going to Market Basket temporarily. Many people have asked why we made that decision. And the reason simply is the lines were too long for people to wait to get inside. And once inside, the lines are too long for checking out. So people just really can't stand that long, that people that take our van. So we're doing Stop and Shop in Beverly and Shaw's in Ipswich. And as soon as this crisis is over, we're so happy to resume going back to Market Basket. We continue to be open with the best staff in the world. Everybody, thank God, is healthy. And the van is still taking people out to grocery stores and prescription pickup. And we also still have our fabulous volunteers that are doing everything that I've mentioned in the prior weeks. So grateful for all of that. We also want to thank everybody that has written nice notes to us, made some beautiful phone calls, and also have made donations. People have asked how they can help. They're just so grateful for the opportunity, for the assistance that either they've been given or know different programs that we're helping people with. So for those of you who may not have yet asked that but are wondering, so our Friends of Ipswich Elderly is our fundraising portion of the Council on Aging, and they are accepting donations and utilizing them for emergency assistance for people, as well as helping towards the expense for the grab-and-go lunch program. So we appreciate any donation that's possible. There are also some wonderful community groups, too, that are helping. So if you have any questions, certainly please reach out to us. Thank you.
Thank you, Sheila. Real quick on the donations, if they wanted to donate, is there information on the website, and how would they be able to make those donations or get the address?
Yep, so the address to the Friends of Ipswich Elderly, it's a P.O. Box 213, right in Ipswich. If the check happens to be mailed to us at the Senior Center, we can definitely get that over to the treasurer of the Friends and deposit those funds.
Okay, perfect.
Thank
Because
you.
people have been asking me, so I just wanted to make sure.
Okay.
Okay, great, thank you. All right, up next, we do have we're not done yet, folks. I know those who have been watching think there's only going to be the same crew of people that are on here, but we have Chris Bellavacqua, who is our director over at the YMCA. He is here, and he will be giving us an update on what's going on with the YMCA and all the good work that they've been doing.
Thank you, Tony. Appreciate it. Thanks for having me. Down at the Y, we've been very busy during this time. It's been a really nice opportunity to collaborate with other organizations in Ipswich that have been providing services to support those in need during the epidemic. We've been focusing a lot of our efforts on food assistance, so collaborating with organizations like the Ipswich Dinner Bell, Open Door Food Pantry, and the Council on Aging to provide volunteers and coordinate volunteers to deliver groceries, deliver hot meals, and bag groceries at the Senior Center. So it's been a nice way to bring our community together. We've had a lot of members participate, a lot of board members come down. It's been really nice to see people come out of the community, or come from the community, and really step up to support each other. It's been really nice to be a part of that. In addition, our Y across all the towns that we serve, we are doing a number of other efforts. So one of the things that we've been working on is providing free childcare for essential and emergency care workers. So out of our Haverhill, Salem, and Beverly branches, we're providing free childcare for any folks that are in those roles. Right now, I think we're serving about 140 or so. We have about 140 kids enrolled, so it's been really great. And in addition, out of our Gloucester Y, we've actually worked with Action Inc. down there to turn that into a shelter, a homeless shelter, during this time. And the response from volunteers has been great, and it's served a big need down there and helped a lot of people. So we've been doing blood drives in some communities as well, partnering with schools. It's been a great chance to see everybody come together and be a part of our community and see how great it's been. So any questions, if you'd like to volunteer, please contact me at the Y. We're always looking for help. If you have people that need food assistance, you can contact Jen Perry at the Open Door for grocery deliveries. If you would like hot meal deliveries, you can reach out to Dorothy Calandra at the Ipswich Dinner Bell and sign up there. As this continues, we'll continue to work with the town and see what other needs we can fill, but right now that's really what we have going, and it's been great to be a part of.
All right, great. Thank you, Chris. Many people may or may not know, but Chris and I are both members of Rotary, the Ipswich Rotary Club here, and they've been doing weekly Zoom calls to replace their meetings, and we were on one this morning, and it was the first one I was able to participate in since the COVID-19 crisis started. And I must say that I wanted to shout out to them. I mean, the level of effort, volunteerism, generosity in that group, and all the local donations and all the hard work they're still doing, even now with this crisis going on, is to be commended. So I just wanted to give a quick shout out to them because that was great this morning. Chris has reached out to me, and we've been talking briefly about possibly doing something a little fun with regard to the community. Obviously, we wanted to get through the surge and the crisis, so we haven't really locked in a date yet, but it will be in the next few weeks or so, probably 2 or 3 weeks out. But I did want to let you know that we are, and I'll let Chris give a little more details on it, but we're potentially looking at doing a drive-in movie setup where people could come in and stay in their cars, practice social distancing, but also kind of a community event. So I'll let Chris give a little details on what we're thinking about doing there.
Thanks, Tony. I appreciate it. So yeah, it's been great to work with Tony on this in the town. So the idea that we came up with was, we have a community partner, kind of a business partner, donor, who runs a production company, and they've been willing to donate big inflatable movie screens, and they've got the capability to transmit sound into the cars. So essentially, set up a drive-in movie theater. And like Tony said, we thought, what are some opportunities we can provide for the community to, kind of break up the monotony of what's been going on during the epidemic has come out, but do it in a safe way and continue to practice safe social distancing. And this is an idea that we had and we came up with. So we are in the process right now of kind of evaluating what the best time frame is to do that and the best space to do it. But we've got all the pieces in place for it to go. So as soon as we've kind of determined the safest time and place to do it, we will be communicating more to the community through the Y, but also through the town, as, again, this has been a great collaboration with the town, and hopefully something that will, bring a little bit of fun into people's lives, give them the opportunity to get out, maybe have a night out with their family in a safe way.
All right, great. Thank you, Chris. We look forward to that event. All right, everybody, that wraps it up for this week. I want everybody to stay safe. Again, thank you for your patience and understanding and all your hard work during this time. So we want to, if you have any questions, please reach out to us at Town Hall. 978-356-6609 is my direct line at the office. You can get me there. I'm there Monday through Friday. And also look on our COVID page on the town website at ipswichma.gov. Again, ipswichma.gov. And that has the most recent, case counts, information with regard to COVID-19, resources, et cetera, et cetera. So we've been able to keep that page up to date. Thank you very much and have a great week.